Begin.
Start.
Okay. Hello. Good morning. I'm Dr. Fatima Samir, one of the doctors here in the gastroenterology.
Hello.
So, okay. Can you please confirm your name and age for me?
Yes, I'm Becca Walter and I'm 52 years old.
Okay. So I'm calling you regarding your result. Is that the appropriate time to call you?
Yes,
Okay. So would you like me to call you?
Becca is fine.
Okay. So can you please confirm the first line of address?
It's a blah, 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 blah.
Okay. And if the line drops at any time, can I call you back at this number?
Yes.
Okay, so I understand that I know that you came previously with some complaints. So can you tell me more about it?
Yes, I was complaining of bleeding per rectum for 6 weeks. And they've
Okay.
done for me a camera test. And then they told me that I need to do another camera test, doctor. So why is that? Why do I need to do another camera test?
Okay, I can see. I can hear from your voice that you're a little bit concerned and worried. That's right.
Yes, I'm concerned. Why do I need to do another camera test? So why did you do the camera test from the start then?
Okay, no worries. So just bear up with me for a few questions and I will explain everything shortly. That's right?
Okay.
Okay, so do you still have the same symptom, the rectal bleeding?
Yes.
There's any started from the 6 weeks. So is it increasing till now?
No, the same.
Did you try to take anything?
No.
Okay. So there's any other thing with it, like for example, any heart palpitation, heart
Any?
racing, any
No.
heart racing?
No.
Okay. Any dizziness?
No.
Okay. Any weight loss?
No.
Any fever?
No.
Okay, that's fine. So you told me that they did for you a camera test before. So did they tell you the result about it?
They didn't tell me anything. They told me you need to do another camera test. I'm not happy with that. Why do I need to do that?
I can see. No worry, I will explain everything shortly. Okay. Okay. So regarding your health in general, do you have any medical condition I should be aware of?
No.
Any medication?
No.
Any allergy to any medication? Anything?
No.
Okay. And this is the first time this happened to you?
Yes.
Okay, can see. So, and regarding your health in general, regarding your diet, so can you tell me more about it?
I'm eating everything.
Okay, so do you usually smoke or drink?
No.
Okay, can see. So, what is the most thing that's concerning you apart from the result? Is there anything?
No, nothing is concerning me. I just need to know why you want to do another camera test.
Okay, so Becca, yes, regarding the sigmoidoscopy or the camera test that have done before, okay, it shows some sigmoid cell have been like some changing of the cells of the colon, okay, and the camera test before it was showed only a small part of the colon, not whole part. So that's why we need to do another camera test to see for all the colons.
What do you mean by small changes, doctor?
Okay, so these small changes can be due to inflammation or any other thing, but that's why we need to make more like investigations to know what exactly the cause or what is the really cause of this changing. So we need to order some like an investigation, including a blood test, full blood count, inflammatory marker, and to do more examination. So what do you think?
And what about the camera test that you want to do?
Okay, so regarding this camera test, it's the same as the other one, but as I told you, it will come it will show all the part for the colon, the whole picture more clearly, and it has some preparation. So are you willing to hear the preparation of this? device.
You told me that you need to do the camera test because to check the extent, I think. So
Yeah, that's right. Yeah.
All right. And what happens after that? Why do you need to check if there is any extent in the colon or not?
To see and discuss what we can do regarding the management plan, and to see what is the exact cause of your rectal bleeding.
No, I don't want to do it. I don't want to do it.
Okay, so what do you think if you come here to the clinic and discuss more about it and to examine you again and to see your investigations, including the full blood count and so on? What do you think?
Okay, so why you don't explain it here?
2 minutes
Okay,
remaining.
actually, it's better to see you and to do more, like the examination, to do it again, because you told me still this bleeding is going on. So I need to do more investigation and examination, if you don't mind, please.
Okay.
Okay, so are you willing to hear the preparation for the colonoscopy and anything?
No, I'm not going to do that. So I don't want to listen about the preparation. I don't want to do another camera test. I think it's okay for me to do this camera test without doing another one.
So why are you concerned regarding that, not doing the other camera test?
You have already told me that there are changes in my colon. So what will happen then if you see that there are some changes also in the other part of the colon?
Okay,
if I do have the changes, so I do have the changes.
Yeah, so for this we can set a management plan, like to refer you to the more specialized doctor regarding this part, and to see what is the most appropriate treatment. Because if it's only in one part, the treatment will differ later. So if it's including all the colon.
Okay. Okay. All right.
So, okay.
Okay, so what is the preparation for that?
Okay, so usually you have to not to eat at least for 6 or 8 hours before this camera test, and 2 hours for the drinking water. Sorry, and
move on to the next station.
Okay. Thank you, Dr. Fatima. I was challenging you, I know, but the case sometimes comes like this. Okay, so sometimes it's difficult to deal with the patient, so you have to think about how to deal with the case professionally. All right, so what is your comment about your performance?
I'm not really sure.
I feel that you are not happy, Dr. Fatima.
Yes.
Why are you not happy?
I don't know actually. So I tried to convince the patient, but he didn't. He didn't convince. So that's why I'm really worried regarding this.
Do you think that you needed more time to explain more about the colonoscopy? I mean, taking more time instead of explaining the result and what will happen in just 2 or 3 seconds?
I think I needed to explain more regarding the early dysplasia and does it really mean?
Yes. So
yeah, I think
it's very important to take the patient step by step, especially if the patient is refusing.
Begin.
Okay. Yeah.
All right. You were concerned about taking the history. Okay.
Yeah.
And then after that, in the management, you were concerned about talking about the preparation. I mean, you explained what's the problem in 2 seconds. Then you said was just telling me, would you like to know about the preparation? And then trying to convince me to do the colonoscopy to talk about the preparation. This is what, okay?
Okay.
So, do you think this is the issue of the case?
No, it's actually regarding the change,
Yeah, so the issue of the case is once you entered the cubicle, you found that this patient is difficult. She
Actually,
is
yes, and I was not really prepared for the difficult one.
It's fine. It's fine. I'm happy
Yeah.
that you've done that. I'm happy that you have done that. I don't bother at all with any mistake that anyone does. Okay? We learn from the mistakes. We all learn from the mistakes. If we don't do mistakes, we are not going to progress in our lives. Okay? So I'm happy with all the mistakes that you have done in the case. So you point out to your weakness, then in your preparation, you avoid doing them, or you try to improve the things that you are lacking. All right? Okay. So
Yes. Okay.
yeah. Let me talk about the performance quickly, and then your marks, and after that the case quickly. Okay. In this case, you entered the cubicle, you found that the patient is difficult to deal with from the start. She is unhappy. They told her that she needs to do another camera test without explaining to her what's the result, and she wants to know why do you need to do this camera test. In her mind, the camera test is one camera test. So you did that. You did the camera test. Why do you need to do another camera test? Okay? So this is the issue. Issue is explaining to this patient, why do we need to do another camera test? And what is this camera test? And what is the aim of this camera test for this? I mean, the aim of the second camera test. Okay? This is the main issue. All right? If you don't succeed to deal with this, your marks will be very low. Even if you took all of the relevant history taking, and you talked about the preparation and these things. Okay? What is your data gathering in this case? You ask her about the symptoms that she came, and she has done what? Camera test before because of bleeding. Do you still have bleeding or not? And then you ask about the red flags of bleeding. What are the red flags? Dizziness and heart racing, as you did. Okay? Then you check her understanding about the previous camera test. Right?
Yes.
What did she do in the first camera test? And what is her understanding about the sigmoidoscopy, the first camera test, the previous camera test? Did they explain what is this camera test for? You can ask this question in the present history, or you can bring it in the management, based on what you prefer, but include that in your consultation. Okay? Then you can ask about the symptoms and causes of early changes. What are the symptoms of early changes in the colon or in the sigmoidoscopy?
Fever, the weight loss.
Fever, weight loss, to exclude, progression and turning into cancer. Okay. What are the causes? What are the causes of early changes? Family history.
Yes.
Family history. These are the things that you can include in your history taking. No need to ask about allergies. No need to ask about, You can ask about diet and smoking, but you can include it in one question. Do you think that you follow a healthy lifestyle? If you want to ask, if you skip it, it's okay, because the issue of this case is explaining to the patient what's going on, what you did, what are you going to do, and what is the aim of this. Okay? And then you ask her about ideas, concerns, and expectations. So in the history taking, I would say
2 minutes remaining.
you can take three, but make sure that you avoid the irrelevant questions like allergies, like dwelling on the personal history. Okay?
Okay.
These are the things that we can comment on the data together. In the management, sorry, I will give you one. So sorry for that. Okay? Why? Your concern in the management is just convincing the patient. Okay? You didn't explain the situation. Her concern is knowing why are you going to do another camera test and what is the aim of the camera test. You told me that, but wallahi in 2 seconds. You give me only one line. You didn't try to build up the knowledge of the patient. You didn't take the patient from the start till the middle till the end. You didn't tell the patient, okay, well, you know that you have done a camera test, right, Mrs. X? Yes. This camera test is for a small part of your colon. Do you know that? No, doctor. Okay. We have done this camera test for a small part, which is called the sigmoid. All right? We found some early changes. Do you know what is the meaning of the early changes? No, doctor, what is that? Okay. Early changes means that the cells are a kind of messy cells, not like the normal cells of the colon. All right? It is benign. It is still
Move on
benign,
to the next station.
but it could turn into cancer. Are you getting me, Mrs. X? Yes, doctor. All right. So you were concerned about the other camera test. We are going to do this camera test or the second camera test to check the whole colon, if you have the early changes in the whole colon or not. We will need to find out if it's for the whole colon or not, and what is the plan in the future. Are we going to do the camera test frequently or long time intervals? So you explain to her what is the early change, why are we going to do the second camera test, and what is the aim of this camera test. Got me, Dr. Fatima? Did you know now what is the difference between what you've said and what should be done?
Yes, doctor.
Got it? So you take the patient step by step, you explain to her everything thoroughly, okay, in a good pace, without just telling her one line and that's it. Okay? Then after that, you ask her, do you agree on proceeding on this camera test, Mrs. X? If she is agreeing, then you can talk about the preparation. If she doesn't agree, then you deal with the refusal structure or the refusal. You tell her, okay, I can see that you still don't want to do the camera test. Is there any specific reason? Ask her why. Then, based on what she says, you can deal with the refusal. You can address her concern. Maybe she tells you, doctor, the preparation was very difficult. I'm not going to go through that again. Then you tell her, all right, I do understand that. But the problem is that this camera test is very important for the prognosis of your treatment and for the follow-up. I know it is difficult to do this preparation, but this is your health. It's very important for your health. This is how to address the concerns. You can just say some support words and then the patient can accept. If you just be compassionate, the patient will be happy with your dealing with him or with your treatment, then he will accept everything. All right? So this is in the management. In the interpersonal skills, one as well. Really sorry for that. Okay? So I was happy at the start that you told me. I can see that you are concerned about the camera test. Let me ask you a few questions. But afterwards, your way in dealing with the situation was, needed some improvement. All right, Dr. Fatima? Well
Yes,
done
doctor,
for the first.
thank you.
Yeah, well done for the first time. You've done. This is the first time to do the station with me in front of many people. So I appreciate that you have done the station. Okay, and I'm happy. Wallah, I'm happy with all of the mistakes that you have done. This is not a wasting of your time or my time or anyone else's time. It's a kind of learning process. We learn from the mistakes of ourselves and from others as well. Okay? All right. You still have plenty of time, Dr. Fatima, and I'm happy with your participation today. Okay? Don't feel down at all. All right? Let's do the next station.